Namaste and welcome to the next lecture of Clinical Ayurved. Myself, Dr. Mayuresh Agte. We are discussing Kamala, and in that regards, I have discussed with you that in today's era we have investigations with us, and we should, or actually we must, use them for our diagnosis purpose as well as prognosis purpose. It is good as a practitioner to you also, beneficial to the patient also, and as I said, it is very important medico legally also. So in any disease where you find that the investigations will help you for your diagnosis, prognosis, you should definitely ask the patient or convince the patient to do the necessary investigations. Many times patients are reluctant to do investigations. In that case, first you have to convince them. Secondly, you have to write it down on the case paper that you have advised the investigations to the patients and list of the investigations, because legally also it is very important to have record that you have registered patient the necessary investigations. So in case of Kamla, LFT, USG like investigations are very useful, and you should not hesitate to do them in your patients. So let us go ahead with the treatment of the Kamla. First, we will discuss Bahupitta Kamla. I have discussed a short in 2 days, 2 lectures back. Let us discuss in detail. Now, in Bahupitta Kamla, there is Pitta Vruddhi, and Pitta is spread all over the body. So, for Pitta Shaman, Madhur Ras, Pitta Ras are very important, and Kasha Ras also. But in my opinion, the best ras for Bhupitta Kamala will be Tikta ras. Why? In the Shlok of Kamala itself, they have described Pandurogi which continues the Mithya Vihar turns into Kamala. So, if Pandu is the one of the reason, and there is Dhatuni Mande as we have discussed in the Pandu discussion, Madhuras and Kasharas, though they are Pitta Shamak, they are Guru for the digestion, and hence, if Pandurog has turned into Kamla, or Pandu is the first avastha in the patient, why we should use Madhuras Kasharas, which will diminish Agni again. So, in my practice, I will always prefer Tiktaras as it is Agni Vardhak, Pachan, Ampachan, then it is Laghu for digestion, and it is Pitta Shamak by its Shita Virya, and hence the Dravya like Guduchi, Bhumyamlaki, Traiman, Patol, Musta are more useful in my opinion. If Agni is good, then you can go for Madhur Ras, that which I mentioned the taste, that sugarcane juice, etc. Nothing wrong in that, but you have to be careful that there should be Agni in a very proper condition. And then other Panchakarma, simply Virechan for Pitta is also commonly used. In Ruddhapada Kamala, as I discussed, first you have to investigate that whether it is in the bile duct or out of bile duct. If it is in the bile duct, then you have to go for the exact reason. If it is in the bile duct, the reason is generally bile stones or gallbladder stones, and that obstruction leads to the Ruddhapada Kamala. So, if the gallstones are the obstruction, is the reason for that Strotorod, the Chikitsa is very simple. Bhedan Chikitsa, as they are Pittashmari, and for Bhedan Chikitsa, you can use any dravya like having Tishna Ushna property like Chitra, Pippali, etc. Now, interesting thing is, if you have Chitrak with you, if you have say Baladak with you, Vedandravya like Danti with you, or and Katuka and Kumari with you. So you have 5 different dravya like Chitrak, Ballatag, Katuka, Kumari, for example. Which one you will specifically choose? Which one will you specifically choose? Now, logically, every drug is logically correct. Nothing wrong in that. But I will prefer Kumari or Katuka more, or the Kalpa like Aragyavardhini where Katuka is the main content, or Kalpa like Kumari Aso where Kumari is the main content. Why? Chitra, if you Chitraka devotee, nothing wrong in that. Then why I will go for these 2 dravya as a first choice of the drugs? Because these dravya have Bhedan action because of Prabhav, and Prabhav is superior to all Rasa Virya Vipa Guna. So Chitra use nothing wrong, but I will give more preference to these dravya because they will work on the Prabhav, and hence their action will be far more superior than other dravya. In Mutrashmari we use dravya Pashanabhed or Varun, which are commonly used. In my practice, if for the bile stones, I also use this dravya as Ashmari Vedan is their Karma. So we can use dravya Kumari Kotuka which have Gamitva on the Rattava Srotas having Vedan action, as well as we can use the dravya like Varun, Pashanbhed, where they have action as a Ashmari Nashan specifically. In Pittashmari, they have already Pitta increased in the natural way many times, so you have to give Pathya, which will a Pathyakar Ahar Vihar, which will have a Pitta Shama actions with these medicines. So in Ruddhapatha Kamala, if the obstruction is in the bile duct because of the bile stones or gallstones, this is the line of action which is very very useful in the practice. Along with this, you can use Gugul Kalpa, which can Gugul again have a Bhedan action. So you can have this Kalpa with or Dravya or Gugul Kalpa for the like Phalatikadi Gugul, which has action on the Ratta, Srotas or Yakrut, and having Gugul as a content which will add to the Bhedan action. Bhasma like Tamra Bhasma, which has got the Lekhan Karma, are also used as it is a content of like Aragyavardhini. You can use these dravya also when the obstruction is in the bile duct by bile stones or gallbladder stones. If obstruction is outside the bile duct, like tumor in the head of the pancreas, then the treatment will be totally different, and hence in last lecture I recommended that in such cases it is always good to have sonography or CT scan like investigations to diagnose that whether obstruction is inside or from the outside. So this is about the Kamala. Ahar Vihar, you know, always it is very simple, Pitta Shamak, etc. And investigations really play a good and main role in diagnosis as well as prognosis. We will meet with the next lecture on in next week. Thank you very much.